The latest study from the CDC is really quite important. This is a 2-year follow-up that's demonstrated that the current prevalence of autism is 1 in 88 children. 2 years ago, the report was 1 in 110. So this is a 23% increase. Of note, 1 in 54 boys across the sites that the CDC surveyed had a diagnosis of autism. These were identified through a number of different sources, through educational and health records, and really represent very accurate data. Of particular note in this data is the increased recognition of autism in traditionally underserved minorities, children who are Hispanic and African American. This is important because these children are underdiagnosed in the community at large. The question of why there is such an increased prevalence identified is one that does require additional study. It's possible that because of the increased awareness of autism, increased education among medical professionals and teachers, that we are better at documenting the symptoms, so this case finding is able to pull out children who were there all the time but were not identified as having autism. It's possible that we're better at early diagnosis, so children are in the system. It's also possible that there's an increased prevalence. And that kind of recognition of environmental factors that may influence susceptibility genes or environmental factors in general is an area that really needs additional study, and studies such as the National Children's Project will be able to look at children prospectively over time and tie together risk factors with developmental outcome. For pediatricians and the primary care providers providing a medical home, it's really very important to pay attention to the Academy of Pediatrics screening recommendations, to do a formal screening evaluation for autism at 18 and 24 months of age. When children fail screening and are referred for a second, more expert diagnosis, either to a developmental and behavioral pediatrician, a child neurologist, or a child psychiatrist, it's really very important that standard diagnostic criteria are used so that we can best serve children, make the most accurate diagnoses, and refer children for effective treatment. And this, I can't emphasize enough, that don't defer, refer. Refer when you identify children with screening, refer for services when you identify children with diagnosis, and listen to the parents. That when a parent is expressing concern, although today we're talking about autism, even if you don't think it's autism, it's something. There's some additional things that we need to be aware of from this study. One is that even though children are being identified as having autism at younger ages than in the past, a treatment is most effective when provided early, so that a diagnosis at 4 years of age really should be a thing of the past. At the next survey, we should be seeing children earlier, when we may have a better chance to change the course of their symptoms. The other thing that's important about the study is the increased identification of children in traditionally underserved populations, such as Hispanic and African American children. And this is important as providers of the medical home, of primary care that is culturally sensitive, accessible, affordable, and coordinated, that all children, including traditionally underserved populations, need to be screened for developmental disorders and need to have the same access to effective treatment. It's really important for the primary care provider who is on the front lines to be comfortable with screening and with supporting families whose children have autism. This is a very common condition. That's what this study tells us. And that for children with autism, as well as children with other special health care needs, the Academy of Pediatrics has developed a series of supports and educational programs to help the pediatrician provide a medical home. In 2007, the Academy of Pediatrics published the Autism Toolkit. A second edition will be published in 2012. The Academy of Pediatrics website has a wealth of information about autism, as well as links to other products that have been developed to support physicians in the care of children with autism. Family organizations such as Autism Speaks and the Autism Science Foundation and the Interactive Autism Network have excellent online materials. The CDC has an online learning program which is very, very, very well done, is very complete, and important for clinicians, has a video library that goes along with it so that you can see examples of how children and youth with autism actually look and behave. Physicians and primary care providers need to be comfortable in reassuring parents that this is not due to vaccination practice, and to help them identify resources in their communities for effective treatment and for the support that they need.